Alameda County Public Health Officer. And here we go. Update on COVID. Welcome, Dr. Moss.
Well, thank you. Thanks for having me. Glad to be back with the chamber, and I know we only have a short time, so I'm going to jump right in. So let's just, if people could nod or give a thumbs up if you're seeing my screen. I see Dawn's nodding.
Yeah. Yep.
Okay, so I'll do just a very quick sort of where we are with the numbers, and then there's been lots of policy stuff, and then we'll have some time for Q&A. So still a lot of COVID around. You may be hearing this in the media, where this has been a sort of a never-ending spring wave. This number at the top of the screen, that's reported lab tests. We don't know anything about home test results. And of course, a lot of people don't get tested at all. That's always been true. So we know that this is really the tip of the iceberg. When we do get laboratory tests reported to us, about 14% of them are positive right now. So that's pretty high by the standards of the pandemic. But lab testing is going down, especially once the school year ended, where a lot of testing was happening. We just get many fewer case reports, and it's sort of changing over time. So that makes it much harder to interpret these numbers. Things are murkier than they were earlier in the pandemic for a number of reasons. A lot of people in the hospital, 145. We've been bouncing between 130 and 150 for weeks now. Only 15 in the ICU, so that's good. 53 deaths since April 1st. We have a COVID death, a death due to COVID illness about every 2 days in the county. This latest variant, BA.5, is emerging here on the West Coast. And so this is what our daily case reports look like. You can see it kind of looked like things peaked around end of May, beginning of June. Memorial Day holidays always make the data more difficult to interpret, but and then things seem to improve, but remember, less testing was happening in June. So I think we've been in this kind of prolonged plateau, bouncing around, really going back into May. This is what the reported cases look like. It's the same data that you just saw, but looking back to the beginning of the pandemic. And you can see pretty substantial wave, but when you think about all those unreported tests, unreported infections at home tests, that spike is probably up at the top of your computer monitor screen over there on the far right. And you can see the big main Omicron winter wave here as well. That also would be a lot bigger if you saw every infection. So just a lot of COVID around. You're probably hearing about this in your lives, maybe friends or family members, your own family impacted. We do look at other data sources to try to understand what's going on. And so this is East Bay Mud wastewater data. We don't have wastewater data for the full county. The pattern here is sort of like what we saw with our cases, though, especially when testing was done at a little higher level, which is things really increased starting in April up through late May. And then there's this kind of plateau period. And the latest data, we're still kind of holding our breath and waiting. It seems like maybe yet another uptick. And we're seeing that in a few other places. This data comes with a pretty big delay at this point. So we're looking into the past, not into the future. Hospitalizations, the other big source of data that we use to try to know where we're doing. And again, the pattern increases in the hospital, mainly in May, up through the early June, and then kind of looked like things were getting better for a while there. And then in late June, another run up. I think if you saw more recent data, you'd see things have sort of flattened out again, but they've just flattened out at this very high level. And the hospitalization increases are what drove us to introduce the new mask requirement in the beginning of June. And then things leveled out and we lifted it. And now, of course, COVID being COVID, there's still a lot of COVID around, and we had this late June bump. But that certainly, taking everything into consideration wasn't enough for us to keep masks on. And so that's just a good segue into policy updates. Mask requirement lifted on June 24th because of the sort of plateauing. We weren't seeing these day-to-day increases, even improvements in some indicators. And it's just, when you're the only place doing something like this, it's obviously requires a lot of public buy-in, it's very difficult. So we lifted it when things stabilized. And as I said, it'd be nice if they were more stable, but this is where we are. We're very grateful to all the residents and businesses who did their best to make this work during the latest requirement. The other big change, and I should say, masks are still strongly recommended. I wear a mask. I've been doing a lot. I've been out and about much more, as maybe many of you are, and I just don't want to get COVID. I'm pretty sure I've had it before, maybe more than once, but I'm not interested in getting it again. So I'm mostly masked up, although we still go to restaurants and things like that. The other big change, quarantine policy. Back in February, the state of California stopped recommending quarantine for most people, but they changed their definition of who was considered a close contact of a COVID case to include pretty much anybody in the same room. It used to be this 6 foot, 15 minutes rule, and now it's everybody in the same room for 15 minutes. We moved a little differently in Alameda County because we like to be different, as you probably know by now. We stuck with the old rules, which included a quarantine requirement for unvaccinated people. But that's just a very small number of people in Alameda County who are actually subject to that at this point. Unvaccinated children were already under state school policy. They were allowed to stay in school even after an exposure. So we weren't really putting a lot of people into quarantine in the county. And quarantine probably makes less sense these days because these new variants, they spread so quickly. You may not know you were exposed in most cases, and by the time you know you were exposed, you probably already got sick. So we have now aligned with the state, and the most important reason to do that in the last couple of weeks is Cal-OSHA finally aligned with the State Department of Public Health with this idea that everybody in the same airspace is considered exposed. So that's going to be important for a lot of your businesses. So it's sort of like you have to consider a broader group of people to be exposed, but most people in most situations can continue to stay at work under the latest change from Cal-OSHA. And there really are no different county rules. That's where we are as well, except in a few very limited settings. Masking and testing is recommended for those in a shared airspace. And I think Cal-OSHA actually has some requirements around this. You'll want to familiarize yourself with those if you have a lot of staff. Other big news, of course, finally, after a long wait, we have two vaccines authorized for the youngest kids. Both Pfizer and Moderna can be used for children 6 months and up. They are safe and effective in the clinical trial data. Kids don't end up in the hospital as much as adults, so it's going to take some time before we see benefits in terms of hospitalizations. But they showed other benefits in the clinical trial that made the FDA move to authorize. And I think it's just important to remind people that although kids are less likely to get severely ill than older adults, COVID is riskier for children than many of the vaccine preventable illnesses for which we vaccinate our kids. So we are endorsing this recommendation for kids. We think it's a good idea. We know it'll be maybe slower uptake than we saw with older age groups. Best place to get kids vaccinated is at the pediatrician's office. Those of you who have kids know this. That's kind of their bread and butter, vaccinating kids. They know how to handle all the different vaccines. They know how to work with young kids who don't necessarily want to be there. So this isn't something that we're going to try to replicate in a parking lot. And we are doing our best to support pediatricians around the county to be able to store and administer a vaccine. And so contact your healthcare provider. Tell people to contact their healthcare provider first. There are other avenues for the people who really need them, and there's information on our website about getting kids vaccinated. Things have pretty much flattened out with vaccinations in Alameda County at a high level. We'll see a little bit of an uptick now that the youngest kids are authorized for vaccine, but things are not going to change too dramatically. I don't have a slide on it, but boosters, we also have sort of plateaued, but actually boosters are really helpful. I think, I was an early skeptic of the booster recommendations. I thought we need more data. Well, now we have the data, they work, you do get protection from full vaccination, but getting that third shot or that first booster dose is real important. And it looks like for the oldest adults, the second booster is also important. So there's a ton of COVID around right now. We strongly encourage people, go get their booster shot. I got mine, and I'm already thinking about when I'll get my next one. There really isn't a downside to this. So, you want to protect yourself against COVID, get a booster. We know that people are getting infections. In Alameda County, I think we've been saying this for a long time. You're likely to get infected if you're out and about, even if you're vaccinated and boosted, but you're much less likely to have severe disease. Still kind of learning what it means for long COVID. I wish I had more information, but we just don't. We don't yet. COVID treatment also available if you have people in your lives who are older, have underlying health conditions. Maybe that's you. You can actually take a medication when you get sick, and it reduces the likelihood of hospitalization. Probably doesn't make as much of a difference for younger people who are otherwise healthy, but for people at high risk of severe disease, there's a few options. Paxlovid is the most well-known one. It's a 5-day pill. You really need to work with a doctor or pharmacist because it can interact with other medications. So we have some resources to help connect people, particularly those without health insurance, to treatment. And we have even a call line that can sort of help point people to the right place. So treatment's out there. It's a great option, probably partly why we're not seeing as much severe disease right now with the amount of COVID that we have. I think this is my last slide. The state did update their school guidance for the upcoming school year. It's much more hands-off approach, like pretty much everything in our lives these days, but still important for people to be aware. I kind of distilled the main points here. If there's a schools person on who wants to jump in or add anything in the chat, please do. But basically, improve indoor air quality. The mask rules for schools are the mask rules for the general public. So right now, that's a strong recommendation statewide. Support antigen testing access for students. Support hand hygiene. Stay home when sick. And then schools should be notifying families when there's COVID cases in the classroom. But kids without symptoms can stay in school. That's been true in Alameda County and statewide really since, I think, February. And then school closures, class closures are very much a tool of last resort. We don't want to disrupt education anymore. It's been enough. And there's a link there if people need to read the guidance for themselves. And last comment, we do have a COVID recovery newsletter. I put the link here on the, I didn't want to do that. I put the link here on this slide, and it is someplace where you can get regular updates on policies that affect workplaces and other things going on with COVID. So if you want to stay on top of it, it comes out of our office, and we think this is a good resource. And I can try to post that link in the chat as well. And that is it for my slides.
Thank you, Dr. Moss. So, any questions? Okay, I see Mayor Warner. Let's start with you, and then we'll go to Ken.
Okay, thank you. I just wanted to say I really appreciate, Dr. Moss, everything you've done over the last few years, and it can't have been easy for you. So really, you've been very helpful, and especially, as we've tried to understand what to do here. And so it's been good. So one question I've got is sort of looking forward. And you mentioned, or you showed, that the vaccine uptake is now kind of plateaued. But in the future, I'm reading the articles about there's going to be a new vaccine, multi-part possibly, or maybe more effective. And have you started thinking about how we're going to convince people to do that, given that there's everything's kind of plateaued there?
Thanks for your words, Mayor, and thanks for the question. Convincing people of anything having to do with COVID at this point is very difficult, and I think we have to be realistic about that. People there's still a lot of COVID around. Obviously, we could see. I think everybody in my sort of who does what I do is concerned about the possibility of more severe COVID coming around. I hope that doesn't happen, but certainly a fear. But people are just, they want to move on. And I think, in the Bay Area, people have really been more attuned to this stuff, but those of you who have traveled outside the Bay Area, COVID is even more of an afterthought, I think, in a lot of places. So it is really an uphill climb. But I think, just getting good information about what the vaccines do and don't do is important. I think sometimes we overpromise, and then, like the vaccines didn't do as good a job of preventing infections over the long term as we had hoped earlier on. And that kind of, people noticed that and they said, well, what's the big deal? Why get vaccinated if I'm still going to get COVID? But the truth is, the real benefit is in keeping people out of the hospital, keeping people from dying. So I think just being, getting the good information out there in front of people, trying to work through, cut through all the noise, and really, I think giving the people a break when we can, so that when the news is important, it really hits. So I think it's like, let people do their thing, and then when the fall comes, if we really need to drive people to get vaccinated, then doing a very, sort of thorough public information campaign at that point. I think that's what the federal government's planning. But I would also say to folks on this topic, don't wait. If you're, don't wait for the future booster. There's a lot of COVID around right now, and I think it's better to get boosted now, and we'll see what comes in the future in terms of vaccines.
Great.
Thank you.
All right, we're going to move on to Ken. Ken Bradley, your question.
Yes, good morning. Alameda County has restrictions tied to the COVID emergency or pandemic, where landlords can't require their tenants to pay rent. And that's in existence until the end of the declaration of the pandemic plus 2 months. We're sort of past pandemic, we're endemic. It looks like it's going to go on forever. How long are we going to have elderly people that put up their life savings for rental home go without income?
Yeah, thank you so much for this question. So this was actually a board action to pass the county eviction moratorium. It wasn't something that came from me, although it is attached to our local health emergency. And we'll have more information to share with the public, I think, quite soon about what we're thinking in terms of the local health emergency, and what most other places don't have this sort of policy attached to their local health emergency, so it's sort of a different consideration for us than most other places. But I think we'll be looking to, in particular, what's happening at the state level for that, and hopefully have more news to share soon. So, I know this has been a tricky one. It's certainly been an added complexity to the local emergency declaration here in Alameda County. And we know that people are very interested in when that's going to be lifted. I would just say stay tuned and sign up for that newsletter. Hopefully, when we have more information, that's going to be a good place for you to get it.
Great.
Oh, and can I just, one other comment? I think we are in a very different place with the pandemic right now than we were earlier on, better protected, although still, a person dying every 2 days. But I wouldn't describe this as endemic. I think people have, that endemic means something different. COVID is totally unpredictable, so that doesn't mean the emergency declaration has to stay in place forever, but I would not describe it as endemic.
All right. Thank you, Dr. Moss. David, first, your question?
Yeah, good morning again. First of all, Dr. Moss, I want to join the mayor in thanking you for all your hard work in dealing with COVID. My wife was actually the health officer for San Joaquin County, and I know we know how hard it is to deal with all the stressors, both to yourself and for the county. So again, I want to thank you. My question is that what you had a slide up that was the percent of total population that's been vaccinated and totally vaccinated. That was by city. And I noticed that Livermore was down near the bottom. I was wondering if you or maybe the mayor or anybody else from the business community has any explanation for why Livermore is significantly different than Pleasanton and Dublin and down near the bottom within the whole county.
I don't know, Mayor, do you want to, I think we've had conversations about this before. I know you've been interested in getting that number up. And by national standards, it's still very good. So, Alameda County and the Bay Area sets a real high bar for vaccination. I don't know, Mayor. If you...
Well, yeah, thanks for sending it to me. I think we've had the conversations in the past of looking at it by demographic, and the demographics in Livermore are significantly different than our surrounding cities. And there's a different uptake by that demographic. But David, thanks for kind of emphasizing. This is what I was trying to get to, is that we do know that we're lower than others. Maybe it's higher than other parts of the country. But I am, and always have been, concerned about our low uptake. And that's kind of why I was asking, are we going to think about having another big push to get people vaccinated? Now we have the current vaccines, but I'm thinking that maybe one way we get out of this and go from the pandemic to the endemic is we have a good vaccine, and we're going to have to convince people to take the new one that's more effective. But it's a concern of mine. And the other thing I'll just say is that, given the data, Dr. Moss, that you gave us about how this is really circulating, I'm myself still hesitant to get into indoor meetings and in-person meetings, and Zoom is pretty effective. So I still think people need to be wary, but I would like to see vaccine uptake greater. And I think that we may need to be prepared to have a big push like we did a while ago, trying to get people vaccinated. And that I know we may have fatigue, but I think the last thing I'll say is, Dr. I like the fact that you said, let's just give people a break a little bit, because when it's going to be necessary, we need people to act. And we can't keep exhorting them to do that continually. So I'm thinking maybe in the fall, winter, there's another push possibly, if the right vaccine is there. So anyway, David, I think it's mostly driven by demographics and cultural differences.
Okay, thank you.
Right. Okay. Right, if we all knew what it would take to make people do certain things, right? Okay. I do not see any more questions from the group for Dr. Moss. Oh, Dawn, yes, Dawn.
And my hand up. Okay, thank you. Thank you, Dr. Moss. Of course, you've been a wonderful resource for us for going on 2 years since you've been doing our webinars out here. So we appreciate that very much. And so I have a few questions and comments. So on the slide with the 53 deaths, or 2 every other day, do you happen to know what the demographics is on that? Is it primarily our 65 plus population, or do you know?
Yeah, it's mostly, and this has been true through most of the pandemic, for deaths, it's really closely associated with age. So we have earlier in the pandemic, we saw some deaths in people under age 50, particularly unvaccinated people. This wave is ongoing, so things could change. But right now, it's mainly people over 60. We have seen some deaths in people under age, between 50 to 60, but it's mainly people over 60, and often it's people over 80. So we're the highest risk. It's just the older you get, the higher the risk is. I can share more about the demographics, but when you're talking about death, age is the biggest risk factor.
Okay. And just for clarification, quarantine versus isolation, are those the same?
Thank you. I always forget to cover this, and I always should. So isolation is when you're sick, when you have got COVID, you tested positive, or you have symptoms and you think it's COVID, and you're still waiting for your test. That's isolation. You stay home when you're sick. And ideally you stay away even from people in your household. Quarantine is when you've been exposed, but you're not yet sick. So quarantine is while you're waiting to get sick, you've been exposed to COVID and you want to be home because you don't know when you're going to start being infectious. And you do that until enough time has passed that either you've got sick or it passed you by. And that's the thing that we've really moved away from over time, just because COVID moves so fast. By the time to stay home, you probably already either got sick or it's passed you by. That's not going to be true in every case, but it doesn't seem to be making a big impact in terms of how COVID is impacting communities at this point.
That's a question I hear often.
Isolation, though, is really important. If you have COVID, you can infect other people, especially in the first week or so. Please stay home. I mean, that's a no-brainer.
Okay. And on the COVID medications, what is the time? I mean, isn't it like within so many days really is when you need to talk
5 days is the time frame for Paxlovid, which is the pill, and it's a 5-day pill. So it's important if you're feeling sick, even if it's mild, especially if you're older, you have a lot of underlying medical conditions, talk to your doctor early. And I think for people who meet those conditions, you have a plan ahead of time. What am I going to do if I get COVID? Because why pass up the opportunity to protect yourself?
Okay. And then just to comment on the surge in April, for me, I noticed the timing happened to work when the federal government lifted the restriction for air travelers to wear face coverings. And it just seemed that that's when everybody started to get COVID. So I think that that's a cautionary tale for folks. I have friends and relatives who started to travel and took the face covering off, and sure enough, within a week or so, they got COVID. And so now when they travel, they just wear the face covering. So that's just, face coverings work. They help.
They do help. I would add to that, Don. This is life getting back to normal, people doing more and more normal activities. That's why we're seeing this wave, which is still going right now, started in early April. This is what happens when people get together. So it's not just travel, it's all these things. And you sort of can't, this is the price of normal that we're paying.
Right. But being in close proximity with 300 other people in a metal tube in the air for X number of hours is probably like an ideal Petri dish situation. So for COVID and other things, right? So those are my comments and my questions. So thank you very much. And I think we have some other questions, Sharon.
Yes, right. So Ken and then Kim.
Yes. Do you have any data on the adverse effects from the COVID booster? Anybody suffering besides me?
Well, I'm sorry to hear that you're having adverse effects. There's a lot of published information. I think the best resource for this is CDC's page on vaccines. So The most common side effects people have from the boosters as well as the initial shots is, arm soreness, often feeling sick for a day, maybe even 2 days. Most people after that are right back to normal, but some people can feel crummy for longer, and I'm sorry that that's been your experience. The most serious side effects known to be associated with the Pfizer and Moderna vaccines are these heart inflammation that's been seen in some teenagers. It's rare. It's actually more common with COVID infection than it is from the vaccine. All the kids who have had this appear to get better. But that's really the thing that's been most concerning. Serious side effects have not been systematically identified from beyond that from the boosters that in a big way, but certainly some people have felt sick for some days. And if you're experiencing longer term side effects, really encourage you to speak to a healthcare provider, because it's very uncommon.
Okay, thank you. And Kim, I think that's probably our last question, right? Okay.
Yeah, good morning. Thank you for being here. I appreciate all the information. This may seem like a silly question, but I mean, are we ever going to reach herd immunity? It seems like so many people have had COVID. So many people have gotten vaccinated, boosted, double boosted. I mean, I'm a mask wearer, sanitizer, wipe things down, and I still got COVID. So, I mean, are we ever going to reach herd immunity? Or are we just going to keep being faced with new variants?
Thank you for this question. Probably not. There's probably not a herd immunity anytime soon. I think that, there's maybe we will eventually reach something like endemic COVID, where it's something that we see at sort of more predictable levels, and it doesn't cause nearly as much disruptions as it's been causing. There are other coronaviruses that are like that. That we get, they cause the common cold. And so eventually it's probably more like that. I don't know how long that takes, but we all probably have to get COVID or get better vaccines, maybe multiple times before we get to that place. But it's just going to take, I think our patience for all of us is kind of worn thin already, but it's just going to happen on a longer time frame. So I think if to stay as safe as possible, wearing those masks, trying to do all the things that we know work. I will say disinfecting, cleaning surfaces, probably something, washing your hands is great. That's the thing that you could probably move away from earlier. It's really, most people get it through the air. So it's the mask and sort of what airspace you're in that's most important. But yeah, it's tough. It's tough to avoid it. You have to be really diligent, and other people in your household have to be diligent. It's tough. And I think that we should at least be thankful that we're better, protected now than we were in 2020 and 2021.
Great. All right.
Kind of a downer note to finish on. I'm sorry, everyone, but things are better than they were, and I think we should appreciate that, and we are able to focus on a lot of other things in our lives, even me. And so, that's a good thing.
Yes, thanks to all of our folks in the science world, right? They're trying to figure this out just as much as we want them to. So thank goodness. Yes, I agree with Dr. Moss, much better than where we were in the beginning. So thank you, Dr. Moss, for answering everyone's question this morning and providing us with that COVID update. Okay, we are going to move on now to our next speaker, which is the new Livermore City Manager, Marianna Marysheva. So Marianna, take it away.
Good morning, everyone. Thank you so much for having me here. I met many of you, but not all of you yet. So it's nice to meet you. And Dr. Moss, what a great presentation and a great discussion. A tough act to follow, so thank you very much. I don't have slides, but I just wanted to really spend a few moments updating you on what's happening in the city from my standpoint, and hopefully getting your questions and comments, and mostly comments and suggestions on things that we can do differently and better in the city. The mayor mentioned some of the key updates that you all are aware of in downtown. Downtown development is continuing. It's something that is very exciting for me and my team. It's a lot of work and it's a lot of project coordination, but it is really exciting to see what downtown is going to become with housing development, hotel, retail, and so on. I also wanted to mention that the Legacy Partners project, the housing project, the first phase is scheduled to open as early as late this year by December. And that's the mixed use building that will have retail on the bottom and housing on top. And it's going to be exciting to not only see additional housing, but also see additional retail downtown and to watch those retail establishments complement what is currently in the downtown area. So that's going to be exciting. And that's next door to the Eden project and the L Street garage. We're also very busy in the city. You know, what's interesting for me, and I probably should step back and mention to those of you that don't know me better that this is a full circle, a homecoming, so to speak, experience for me. I've been in local government for about 26 years right now. I started my career in the city and county of San Francisco in '97. And at that time, if those of you that kind of follow local politics, Willie Brown was mayor and Gavin Newsom was on the board of supervisors. Then I went to the city of Oakland when Jerry Brown was mayor and worked on some interesting projects in both cities, focusing on affordable housing and homelessness in San Francisco. You may recall when Gavin Newsom ran for mayor, he focused on care, not cash programs, so providing services to the homeless population as opposed to the handouts. And in Oakland, our focus was on economic development, downtown revitalization of all things, as well as business engagement. And I'll talk a little more about that at the end. I've been to many other cities in California, including as little or as small as town of Mammoth Lakes to as large as Riverside and Irvine. And Irvine was my last city before I came back to the Bay Area. As Livermore's new city manager. It is really exciting to be here. It's an amazing community. You know, one of the I think, adjectives that I use to describe the community is people are just kind and genuine. And that's just amazing. It almost doesn't exist anywhere else in the world. I brought my family here, my 12-year-old children. I have a boy and a girl. They're going to be going to Christensen Middle School. So really excited to be here with our family. What I see inside the organization, it's a very busy organization for a relatively small size of the community and a very small size of staff. We do a lot. And the mayor sees it. Those of you that touch city organizations see how much is happening. And I'll just give you a few highlights, a few examples, really. Things that will resonate with you, things that you're aware of, but just kind of putting them on the same page. We're actively working on the update of our climate action plan, something that is not just a plan, but will have very implementable measures, not only for the city, things that we can do to impact the climate change, but also things that residents and businesses can do. So we're really excited to roll that out very, very soon. Of course, the sewer line extension is going to go before the council in July and will potentially and most likely end up on the ballot in November. And that's going to be huge for South Livermore area and the wineries. The general plan update is something that we continue to work on, and it's a critical document that will help us plan the future of our town in several specific areas, really in the entire city, but we focus on 5 specific areas, including the Isabel neighborhood and transit-oriented development and so on. And that will be before the city council in September, so please watch our council meetings. We're also working on the cultural arts plan to continue planning the future of arts and culture in the community. We're working on a number of connectivity and beautification measures that have to do with our sidewalks, looking at our sidewalks and really trying to have both a short-term and a long-term program to improve them. And of course, sidewalks come with trees, and so looking at the trees and how we can improve long-term sustainability of our sidewalks. Working a lot also on three groups and engagement with three groups. One is residents, and engagement with residents is something that is an ongoing process, and it doesn't go one way where we just provide information, but really hoping to engage residents in many more ways than we have been. And of course, coming out of COVID, it's becoming much more important for us to do that in person at farmers markets, at town hall meetings, at community events, and so on. So there will be many more opportunities for us to do that. And we're very thoughtful and strategic when it comes to that. Secondly, engaging our own city employees. Again, with everyone being virtual for so long, there's somewhat of a disengagement, and you all have businesses, you know how important it is for us to keep our employees engaged, help them grow, make sure that we know what their needs are. I was just talking to someone at 7 o'clock in the morning as I was coming into the city hall, and he said, look, I'm about to retire, and there are about 50 other people in the city that are looking to retire, and that's going to create a gap in knowledge and experience. So it's things of that nature that we're dealing with internally. And lastly, with regards to businesses, what I'm focusing on is business engagement, and through this wonderful platform that the Chamber has created for us, engaging with local businesses on your needs. When it comes to the city, we want to know how we can serve you better. We want to make sure that we have the reputation of being business friendly. So if there are processes for us to improve, if there's anything in the city that you think needs to be done differently, we want to hear from you. We want to figure out a way to engage with you through, most likely through the Chamber, so that we could receive that information and feedback from you. I also would like to know what information you might need from us. As an example, in many other cities, what we have done is reached out to local and mostly small local businesses to share with them how they can participate in cities' bidding opportunities for services and supplies. It's something that we're yet to do in Livermore. I have a very small group of staff to focus on this, but it's something that is on my radar. So those are the kinds of opportunities that I would like for you to be aware of, but also to share your input and your ideas with me and with Mayor Warner and others in the city, so we can continue to serve you better. So with that, let me stop and see if there are any questions or comments for me. And thank you again for the opportunity to be here.
Anybody have any questions for Marianna? Or comments?
I am not as popular as Dr. Moss. I should have come with slides.
Welcome, welcome, welcome.
Well, thank you so much for being here. Hopefully you all know how to reach me, and if not, you can always do that through Mayor Warner or Dawn or others. I'm always here, always open to suggestions, ideas, questions. Let's make sure that we have that dialogue on a going forward basis.
Great. Thank you.
Marianna, this is John Freeman. I just want to welcome you to the community. Look forward to working with you in the future.
Thank you so much. Good morning, sir.
She's such a good sport. Look at that. Okay, right, Don. So I think that is going to be it. And our announcement is there's no meeting in August. So y'all can Zoom yourselves in, but no one else is going to be here. So no